In today's video, let's discuss the 7 indicators that your kidneys might be under strain. I want to create a straightforward video about kidneys without unnecessary details. We'll concentrate on the crucial points. Note that this video is for educational purposes only and does not aim to replace your doctors. You should understand how to keep your kidneys healthy and what steps to take if your kidneys are not doing well. So why do we have kidneys? Well, their main job is to filter the blood, but it's not like an oil filter in a car. It's more complicated. The kidneys remove harmful substances and help reabsorb the good ones. If this intricate filtering process is compromised, you start losing essential nutrients, and waste products build up in your system. The symptoms of kidney problems, whether in the early or late stages, are directly linked to damage in this filtering system. Now, some early warning signs include a strange metallic taste in your mouth, indicating toxins building up. Itchiness all over your body and ammonia breath are also signs. Later on, if your kidneys are toxic, you might experience edema, which is swelling. Press your finger into your lower leg, and if it leaves a dent, that's a red flag. Swelling in the lower ankles and feet is common, as the kidneys and liver work together. If you notice pitting edema in your lower extremities, your kidneys are likely in trouble. Another place you might see edema is under your eyes. Puffy, swollen bags can indicate kidney issues. There's also a symptom called uremic frost that you might experience. Uremic frost occurs when substances, particularly uric acid, accumulate in the body and start coming out through the skin. Typically, you'll see tiny white specks resembling frost on your scalp or the front part of your head. This happens because the body can't eliminate these substances properly. Another common indicator is high blood pressure. If the kidney's filter is damaged, it hinders blood flow, causing a backup in increased pressure. High blood pressure itself can harm the kidneys, much like excessive pressure damaging a water filter in your house. The kidney, acting as a filter, consists of many tiny filters called glomeruli. Each kidney has about 1 million of them. These filters do the crucial work of filtering and recycling specific nutrients, ensuring you don't lose essential vitamins, minerals, and amino acids. Feeling extremely tired is a common signal that your kidneys might be in trouble. The reason behind this fatigue is urea, a byproduct of too much protein in the blood. If there's an excess of urea, you're likely to experience extreme exhaustion. Next up is the presence of a large amount of protein in your urine. If a urine test reveals significant protein levels, it's a sign that your kidneys are likely damaged. A small amount of protein might indicate something else, but if a lot is passing through the filter, there are likely holes and damage. Number 6 on the list is having very acidic urine. Your body becomes more acidic due to an imbalance with ammonia, which is highly alkaline. This imbalance affects your body's ability to buffer effectively, causing ammonia to build up in some areas and not others, disrupting your pH balance. Another reason for increased acidity, especially in diabetics, is a lack of insulin control leading to uncontrolled blood sugars. If not managed, this could potentially result in ketoacidosis, but it's crucial to note that this is different from nutritional ketosis, where dietary changes are intentional. Ketosis and ketoacidosis are different situations. Ketoacidosis happens when someone with diabetes isn't taking their medication or managing their blood sugars properly. Now, let's talk about the 7th sign, low vitamin D. If your kidneys aren't functioning well, you won't be able to convert vitamin D effectively, leading to a deficiency, along with a shortage of calcium. This deficiency can result in various issues like artery calcification, atherosclerosis, kidney stones, and calcium accumulation in different parts of the body. Now, let's switch gears to the primary causes of kidney damage. Undoubtedly, the number 1 cause is diabetes, especially when there are high levels of glucose circulating through the body and kidneys. For the kidneys, glucose is like using steel wool or sandpaper inside, causing significant damage. The kidney is one of the 4 crucial body tissues that suffer damage from high glucose levels. The others include the heart, blood vessels, nerves in the brain, and the eyes. Diabetes takes a toll on the kidneys, causing significant destruction. A quick side note. When we talk about normal blood sugar like 80 milligrams per deciliter, it means there's only about 4 grams, equivalent to 1 teaspoon of sugar in the blood. Now, consider that an average person usually consumes 15 or more teaspoons of sugar every day, yet it doesn't immediately reflect in their blood test results. This is because the body works hard to keep sugar out of the blood using insulin, a hormone that constantly removes sugar to prevent artery damage. However, the excess sugar has to go somewhere, and one sign of diabetes is finding sugar in the urine. The kidney filter has to work extra hard to eliminate this surplus sugar. The surplus sugar is like a blowtorch to your kidneys, causing oxidation and significant damage. It's astonishing how the body manages to respond and survive with the amount of sugar the average person consumes. Now, let's delve into the main causes of kidney problems. Diabetes takes the lead, acting like a blowtorch with its oxidative effects. The second major cause is high blood pressure, often triggered by diabetes as glucose hardens arteries, reducing elasticity and increasing pressure. Low vitamin D, potentially caused by kidney issues, and low potassium are two significant contributors to high blood pressure. And this connection forms a circuit where one problem leads to another and vice versa. Another, though less common because of kidney damage, is polycystic kidney disease, usually a genetic issue triggered by toxicity in the body, particularly affecting the kidneys. In later-stage kidney disease, people might develop cysts. Glomerulonephritis, inflammation of the tiny filters called glomeruli, is yet another cause of kidney damage. The question is, what leads to inflammation in these tiny filtering units? If you guessed diabetes, you're correct. It's safe to say that the majority of kidney problems stem from high blood glucose levels. So what can you do with this information? Well, adopting a low-carb diet might be beneficial. Now, before we dive into specific foods, let's touch on potassium. If you're in the end stage of kidney disease, it's crucial to watch potassium intake. However, if you're looking to prevent end-stage kidney disease, consuming sufficient potassium is vital as it can protect the kidneys. Now, a couple of other things to consider are vitamin D and calcium. Kidney damage often leads to low levels of vitamin D, which in turn results in low calcium. Without the proper transportation mechanism for calcium, you might develop calcification in your arteries, joints, and even kidney stones. With that information in mind, let's explore the best foods for kidney health and preventing kidney damage. Undoubtedly, the top choices are leafy greens. Asparagus is excellent for the kidneys, aiding in the detoxification of uric acid. Kale is another powerhouse, loaded with various phytonutrients that protect the kidneys. Then there's celery, which provides essential nutrients for kidney detoxification and overall health in a gentle manner. Periodically consuming celery juice can act as a kidney filter, and it's known to quickly alleviate puffiness around the eyes. Incorporating celery into daily meals, especially the last one or a little later, may not only benefit the kidneys but also contribute to improved sleep and help with edema in the ankles and under the eyes. When it comes to protein, fish and seafood are top choices, along with high-quality meats like organic and grass-fed options. However, it's crucial not to go overboard with protein intake. Aim for a moderate amount, around 3 to 6 ounces per meal or maybe 7 ounces. Elevating the quality of your food becomes especially important in preventing kidney problems, as not only does diabetes and high blood glucose harm the kidneys, but drugs and medications can also contribute to kidney damage. Various medications often have side effects on the kidneys because the kidneys are continually filtering blood, and medications and drugs end up in this filtration process. Constant exposure to medications and drugs can lead to kidney damage. It's essential to avoid foods with pesticides and herbicides, and choosing organic coffee is crucial due to the high pesticide levels in conventionally grown coffee. For those on a low-sodium diet due to kidney problems, it might mean minimal salt consumption, which can result in muscle weakness and lethargy. However, there's a fantastic alternative, Baja Gold Sea Salt. Unlike regular sea salt, which is usually over 95% sodium, Baja Gold Sea Salt is 70% sodium and packed with 90 minerals, including high levels of potassium and magnesium. It not only benefits the kidneys, but also supports overall body health and enhances the flavor of your food. Certainly, refined foods, junk foods, high sugar and high carb foods are detrimental to the kidneys. However, it's crucial to note that certain foods considered healthy can also be damaging due to high oxalate levels. Oxalates combine with calcium to form stones that can harm the kidneys. Foods to potentially avoid if you have kidney problems include spinach, almonds, kiwi, beet leaves, beans, and grains. Regarding fluid intake, if you have kidney damage, it's advisable to drink at least 2.5 liters per day to prevent the concentration of substances that could lead to stone formation. Lastly, for those with kidney damage, consider a supplement called Rena Food from Standard Process. Taking one before bed for about 2 to 3 months may prove beneficial. While I don't sell this product, you can find it online through a search. Now armed with this information, it's essential to understand the complete diet. The recommendation is to follow a healthy keto plan, and there are step-by-step videos available for guidance.